Alright guys, we're going to talk a little bit about shoulder anatomy. Here I have an excellently drawn picture by myself of the back of your shoulder and the front of your shoulder. I don't have all the muscles in there because I couldn't figure out how to artistically make it happen. But here we have the back. So we have your teres minor, infraspinatus, and supraspinatus right here, three of the muscles of your rotator cuff. They attach onto your humeral head right here, so this bone right here, and they kind of keep the joint stable. They're active stability, so they keep the head of the humerus where it's supposed to be, as other muscles like your delt and your lat and your pec move the shoulder around. So on top of those, we have your rear delt sitting right here. Beyond just the glenohumeral joint right here, we have your shoulder blade, your scapula, and that actually moves as well. So when your arm goes up in front or to the side, you only get about 120 degrees on average range of motion from this joint, and your shoulder blade is a moving platform that your arm sits on top of that also rotates upward or down or back or whatever. So also important is this acromioclavicular joint right here, so your AC joint that a lot of people, if you played football, might have sprained at some point, seen it sprained. Your pec actually attaches to this, your upper trap attaches to the clavicle, so pretty important joint here. From the back we have, or from the front, if you look straight through your rib cage, we have your subscapularis. This is the fourth muscle of your rotator cuff. It helps you rotate inward like this. And it's actually one of the biggest muscles in your shoulder. It's kind of a surprisingly large muscle. I also put the biceps here. So your long head bicep tendon, this guy travels up right along here and inserts into your labrum. And a lot of the time when you have a labral issue or even like rotator cuff tendinopathy, a lot of that load shifts to the long head bicep tendon to keep your shoulder stable, and that starts to get irritated too. So a lot of people have pain. You can kind of dig in right there and feel it. When you have a labral repair, if you have a slap tear, a lot of the time they'll do a bicep tenotomy and reinsert your bicep somewhere else so it doesn't pull on the labrum anymore. So that's basic shoulder anatomy. Got your shoulder blade, helps you move up, got your glenohumeral joint, got your AC joint right here, got a few other things going on that all need to work together to make your shoulder do what you want it to do.